So what are your thoughts on PSA screening for prostate cancer?
I wish that was a
Well, I
straightforward
know,
answer.
right?
People talk about screening tests for more common types of cancer, like breast cancer, colon cancer. Those are very well hammered out. Over the years, PSA they've been trying to figure out what your break point is, who gets it, who needs it, how early. I mean, there are certainly aggressive prostate cancers, as I'm sure you know better than any of us. But there are prostate cancers that smolder along. And if you catch them too early, are we doing people favors by putting them through a biopsy, surgery, radiation, chemo, that kind of stuff?
Interestingly, now is the focus on shared decision making.
Yes.
Having a longer conversation even before you consider PSA screening for prostate cancer.
That's right.
Talking about what to do with the results, what they mean,
Yep.
how to manage those, what would otherwise be seemingly simple blood tests. It's a more complex conversation, I think, than some of the other screenings for cancer.
So it's not one of those cancers where we need to jump in and treat it right away. Certainly there are cases like that, but I think it's one of those things where you look at the global picture of what's going on. There's obviously the signs and symptoms that we think about when you kind of read the classic textbook things, maybe pain in your lower back. Maybe you've got issues like emptying your bladder, you're straining more. You find like you're dribbling or something and not being able to expel everything in your bladder. The other classic tale is like you wake up multiple times a night to pee, and that's kind of the thing. You can get blood in your urine with prostate cancer. It's not the most common thing that you see.
Yeah.
Bladder cancer for sure. Kidney stones, those are probably higher on your radar for blood. But if you do see blood in your urine, you need to get that checked out.
Absolutely.
But those are the major things. And then the other thing to know is that it's one of those cancers that has a propensity to spread to the bone. So if you've got some new lower back pain that just popped out of nowhere and no really good explanation for it, that's something worth looking into for sure.
There's definitely benign reasons as we get older, as men age, you can have benign prostate hypertrophy.
Yep.
That, BPH that can cause similar urinary changes to a prostate cancer.
Yeah.
But I think if you're noticing changes more quickly than just what would be expected as we get older,
sure.
I think that's when it's so important to bring those symptoms to the attention of your primary care doctor.
Yeah.
I think in those situations, PSA screening is very important.
There are definitely a lot of treatments that we talked about. They can be very effective. They can last for years, plural. And so you do see that survival getting pushed out more and more and more.
Yep. It's an exciting time for us.
Oh, big time.
Because we have so many more tools now to help patients live longer and live better, even with a prostate cancer diagnosis.